making time to join us tonight for this informational session on the scholarship program for the Latin American School of Medicine in Cuba. My name is Ibtihal, and I am one of the program coordinators for this scholarship that's offered by the Cuban government and run by IFCO Pastors for Peace, based in New York City. I'm looking forward to sharing information about this incredible program with you all, and hopefully we'll have some time to hear from those of you on tonight if there are any questions that you have from those of you that are applying. And we can get started. So before we jump into some of the more detailed information about the program, we wanted to touch a bit on ELAM's history. ELAM was founded in November of 1999 as a long-term solution to the devastating effects of poverty and the resultant weak or non-existent healthcare infrastructure in underdeveloped countries of the world. So after Hurricanes Mitch and George ravaged parts of the Caribbean and Central America in 1998, causing a death toll of thousands and displacing over 1 million people from their homes, Cuba sent healthcare workers and brigades to help these vulnerable populations. Within a short while, it became quite apparent that many of the people that they were working with had never had any medical care. And so understanding that emergency aid or short-term solutions wouldn't be sufficient for the much larger problem at hand, which is the lack of health infrastructure in the most vulnerable populations in the Caribbean, Central, and South America. This is the context that ELAM then emerges from. So following these hurricanes, Cuba transforms a naval base into an international medical school to accomplish this greater mission of training physicians for disadvantaged communities all over the world. And this is where ELAM is born, and this idea of tackling health inequalities in a structural way lies at the heart and core of what this medical school and this program exists for. And we can go on to the next slide. So we've talked about ELAM and its goals and its mission, and we're going to speak now about how IFCO comes into the picture. So maybe some of you have heard, because of the way that the application is structured, that you're applying through IFCO. So what is IFCO? IFCO is the Interreligious Foundation for a Community Organization, which was founded in 1967 by Reverend Lucius Walker. And it was established through a mission of supporting marginalized communities by contributing to the advancement of human and civil rights. And so through the Pastors for Peace project, IFCO solidified its solidarity with Cuba through friendship caravans that would deliver humanitarian aid to Cuba through openly challenging the US blockade. Now, in its current state, IFCO supports through its fiscal sponsorship program, which includes administrative support for grassroots organizations. IFCO supports the ELAM medical program and the scholarship, which is why we're on here tonight, and various other solidarity campaigns, as well as educational training and leadership development. And IFCO is currently led by Reverend Claudia de la Cruz, who continues in this legacy of solidarity and principled internationalism. So if we jump to the next slide, we're going to read a quote by Fidel Castro. "We are prepared to grant a number of scholarships to poor youth who cannot afford to pay the $200,000 it costs to get a medical degree in the United States." President Fidel Castro says this statement in Harlem at Riverside Church in September of 2000. And we know that since, the statement was made, and we'll give the context in the next slide, the cost of a medical degree has gone up significantly. The training that's required beyond just the 4-year medical degree has significantly increased. And so if we jump to the next slide, we'll contextualize a little bit where this offer came from. So after the school was founded in 1999, a year later, members of the Congressional Black Caucus of the United States House of Representatives visited Cuba on a tour led by Reverend Lucius Walker, and they were impressed by the achievements of the Cuban healthcare system in ELAM. So they requested medical school scholarships for United States students. And later that year, President Castro visits Harlem and announces the offer of scholarships to youth from the United States, like we just read. And in 2001, IFCO Pastors for Peace accepted the responsibility of administering the scholarships to US citizens. And then later that year, the first group of US citizens began their medical medical studies. That first group graduated in 2007, and many of them later served in the Henry Reeve Disaster Medical Brigade, joining Cuban medical doctors caring for victims of the 2010 Haitian earthquake. And so we see that the purpose of the scholarship and the mission has remained the same to help address physician shortages in the most medically neglected regions of the United States by training socially committed doctors who then will return to serve their communities. If we go to the next slide, and so this we're talking about now the mission and vision of ELAM, which is to train doctors of science and conscience. And I'm sure that's maybe why many of you are attracted to this program and want to apply to this scholarship. And we have here another quote from President Fidel Castro, explaining the vision of the school when he says, "What we want from the Latin American School of Medicine is for students from our sister nations to become imbued with the same doctrine in which our own doctors are educated, with that total devotion to their noble future profession. For a doctor is like a shepherd, a priest, a missionary, a crusader for the people's health and physical and mental well-being." And this is kind of the core understanding of ELAM's project and what it means to study medicine in Cuba. So we can jump to the next slide. So now understanding, the context of where this program is coming from, the context of the scholarship itself, what is the criteria for the scholarship? The applicant criteria has actually shifted a little bit this year. So now the requirements are just to be 18 to 25 years old, to be a United States citizen, to be a high school graduate, with no criminal background, and last but most certainly not least, and arguably maybe the most important, committed to practicing medicine in poor and underserved communities in the United States after graduation, because that is the core belief of what medicine, how medicine is to be understood socially, and the social responsibility that comes with studying medicine in Cuba. And the scholarship covers tuition and fees, housing and meals, school supplies and Spanish language textbooks, monthly stipend, medical care, uniforms and essential equipment. And what isn't covered is airfare and travel expenses to Cuba, personal expenses. And once you enter this program, know that you cannot work while studying, just in terms of like managing your studies and also living in Cuba. We can jump to the next slide. So we've covered the applicant criteria and what comes with this scholarship. And now we're going to talk a little bit about what type of education you get at ELAM. So you'd most definitely get a well-rounded education, and you're studying in an educational environment that focuses on collaborative learning. The education is holistic from start to finish, where you learn about the biopsychosocial model, which is seeing your patient as a whole person. The biopsychosocial model emphasizes the importance of understanding human health and illnesses in their fullest context. And this approach systematically considers biological, psychological, and social factors and their complex interactions in understanding health, illness, and healthcare delivery. So studying in the Cuban classroom requires collaboration rather than the cutthroat competitive culture that's groomed in pre-med and medical learning environments in the United States. The emphasis of ELAM training is based on the strengths of the Cuban healthcare system, which is primarily care-focused and oriented by community medicine. So you receive public health training, making you well prepared upon finishing your studies. And now we'll talk about kind of the 7-year curriculum structure that is covered under this scholarship. So you start initially with a pre-med year, and this preparation is for language and basic pre-medical coursework. So it used to be that when you applied for the scholarship, you had to have a certain level of coursework under your belt before starting this program, and that's shifted this year. So you can come in not having any of the previous coursework, and you'll be caught up in these pre-med years. So the school provides 2 semesters of an intensive Spanish language program with fundamental to intermediate level preparation, as well as medical Spanish. So it's also another question that we get asked a lot. You want to go to the program, but you don't speak any Spanish. Well, that's what these pre-med years are in existence for, to help you get caught up, so that once you start the curriculum, once you start the coursework, you are able to take the coursework properly in Spanish. So your first and second years then are preclinical basic medical sciences, covering biochemistry, molecular biology, histology, anatomy, and physiology. Um, the list goes on. That's listed on this slide. Your third to fifth years are your clinical rotation years, and they include 1 year in the internal medicine rotation before you delve into surgery, obstetrics and gynecology, pediatrics, public health, psychiatry, again, and the list goes on. And then your sixth year is where you're focusing on rotational internships in internal medicine, general surgery, obstetrics and gynecology, and pediatrics. And upon completion, students sit for the final Cuban national medical exam, and successful completion confers the degree of doctor in medicine. So we've just kind of covered the criteria and the coursework. Um, And I think it's important here to also emphasize that the goal from this program is the ability to train physicians and doctors who understand preventative medicine and population health, and are then able to implement and act upon that. So globally, we understand this model to be one in which medicine is rooted in solidarity and social responsibility, not profit. And I think, as many of us are aware of and remember, the way that COVID-19 was handled in the United States compared to in other places around the world, and understanding also in general how essential it is to have public health minded health workers who understand prevention and population health, that are then making our decision, that are involved in decision making. Um, if we can move on to the next slide. So ELAM's global impact. The global impact of ELAM is quite significant. There are thousands of students who are enrolled across all of the cohorts, with graduates from over 120 countries. And all of this is under an admissions policy that prioritizes candidates who come from poor communities, which makes ELAM that much more unique. And there's a quote on this slide from Dr. Margaret Chan, who's the former Director General of the World Health Organization, and it says, I know of no other medical school that offers students so much at no charge. I know of no other medical school with an admissions policy that gives first priority to candidates who come from poor communities and know firsthand what it means to live without access to essential medical care. For once, if you are poor, female, or from an indigenous population, you have a distinct advantage. This is an institutional ethic that makes this medical school unique. So just wanted to emphasize that, part of ELAM's mission is to make accessible a medical school degree where to individuals who typically wouldn't have this opportunity because of the inequalities and structural inequalities that exist in the United States towards studying medicine and being able to do so, um, in a way that doesn't completely drive you into debt. Um, so yeah, we're going to talk a little bit about some of the considerations for U.S. medical certification, and your ability to reintegrate into the healthcare system in the United States. So returning to the United States means doing the extra work required by the U.S. licensing and graduate medical education systems. But as we can see by this map, the dark blue are states where U.S. physicians are currently working. There's been a significant reach. Um, oh, good. Okay. Um, if we can move on to the next slide. US citizens who have studied abroad are considered international medical graduates and are required to take the same licensing exams as medical students who have studied in the United States. All medical students in the United States must take the United States medical licensing exams. Currently, it's a three-part process that includes taking USMLE Step 1, Step 2 CK, an occupational English test, and applying to a pathway for clinical evaluation. The Educational Commission for Foreign Medical Graduates is the entity responsible for the certification of all medical students who have studied abroad and want to be incorporated into the United States healthcare system. And so we say this, but becoming a doctor in the United States from ELAM is very possible. In 26 years, ELAM has graduated 245 physicians from the United States, representing 31 states. The majority of these graduates come from working class, African American, Latino, and immigrant communities. And most students are first generation university and professional students. And here's some of the demographic breakdowns of that. Um, if we move on to the next slide, US ELAM graduates are there are growing numbers in public health, education, community health, global health, and social medicine. This slide also covers some of the significant residency milestones with 144 graduates accepted into residency programs, as well as the distributions across family medicine, internal medicine, pediatrics, emergency medicine, psychiatry, OBGYN, and etc. If we can, perfect. So what all of these doctors bring to the medical practice is a deep commitment to the practice and the betterment of society. So bringing humanism to the core of the medical practice. There's a quote on here from an ELAM graduate in 2017. Cubans would say there's a role the physician has to play around addressing gun violence in the community, around addressing addiction in the community, addressing police brutality in the community. Those are things people are dying from, even if there's not a pill for them. You need to understand the impact that all those other social, political, and economic stressors have on someone developing an infectious disease, diabetes, or hypertension in that atmosphere. There's medicine in that too. You have a responsibility in that too. Um, and so, understanding that when you're treating a patient, that there's so many other underlying conditions that have landed this patient to where they are at, and approaching medicine from a humanist way is the most important. So a part of this then is also understanding that ELAM, as it is located in Cuba, is deeply imbricated in the way that Cuba approaches life. Um, and this quote at the top says, "Cuba shares what it has, not what it has left over." So maybe you don't know much about Cuba now, but choosing to study at ELAM requires learning the history of US-Cuba relations, especially regarding the US government's cruel blockade of the island. Assess an assessment of your knowledge about Cuba's success in the face of over 60 years of siege, and learning about the current struggles facing Cuba. The calling to be a Cuban trained physician will need you to adapt to many challenges if this is a path that you choose. So there's the commitment on the level of scholarship, but also one that is socially aware of the conditions under which the scholarship is taking place under. So, as a US student living and learning in Cuba, you must be familiar with the realities of living in Cuba, the realities of resource limitations due to the US blockade, the realities of simple living conditions, frequent power outages, and fuel shortages. There's an understanding that when you go to Cuba to study, that you are entering a politically conscious environment, that while you are being grounded and trained in the Cuban medical model, as a US student, you will also later have to learn US specific clinical frameworks to pass certain examinations. So attending ELAM in general requires a level of flexibility and adaptability to the conditions and the process at hand. What grounds this program, though, is that Cuban medical internationalism continues to be a cornerstone, and it continues to be significant in every aspect of this program. So ELAM is part of a long history of service and solidarity by the Cuban government. ELAM emerges out of this tradition of offering medical education not as charity, but as a continuation of Cuba's global mission to advance health equity. The Henry Reeve Brigade was created from a spirit of solidarity and has served in over 55 countries in response to disasters. Cuba thus offers hope for many people globally. And in 2005, after Hurricane Katrina devastated New Orleans and other cities in the United States, Cuba offered to send a medical brigade to help on the ground. The Bush administration refused that helping hand, yet this gesture remains one of the most explicit expressions of Cuba's unwavering commitment to putting humanity first. And that's what lies at the heart of the scholarship program. That despite the the harsh administrations, despite the approaches to Cuba, that internalizing the Cuban approach to medicine and community care. And so the next slide just kind of covers, what are some of the ways in which Cuba sets the example for us medically and socially. There's free universal healthcare in Cuba, free primary care centered and a preventative approach to medicine, high doctor to patient ratio, higher life expectancy than the United States, a low infant mortality. Um, and as many of you may know, during the pandemic, Cuba developed 5 COVID-19 vaccine candidates, three of which were successfully used to vaccinate 95% of the eligible population, which compared to the way the United States handled the COVID-19 pandemic is a stark difference. And the next slide, um, again, emphasizing that we can learn from Cuba to help US communities. So, in a report released by the Association of American Medical Colleges, the United States will experience a shortage of up to 124,000 physicians by 2034. If populations that are underserved by the health system had healthcare use patterns similar to populations with fewer access barriers, this shortage increases to 180,400 physicians. Under-resourced and underserved communities continue to bear the brunt of the disease burden and an incredible loss of productive years to disabilities and premature death. The ELAM Scholarship Program offers a tremendous opportunity for young people from communities that are underrepresented in medicine in the United States. Cuba has one of the highest doctor to patient ratios in the world, like we said earlier, and it continues to share its intellectual resources globally through service and solidarity. Um, US ELAM graduates return to their communities fully bilingual and culturally competent professionals who have trained in the biopsychosocial perspective and remain dedicated to serving disadvantaged communities. And in this slide, we have some resources to learn more about ELAM and its achievements, and some essential documentaries that are available for free online, as well as some news sources that have covered um, the, uh, the scholarship program and the school. And before we end on this aspect of the presentation, just wanted to really emphasize to follow up with requesting an application. The deadline for the applications is February 15th, 2026. You can also check out our website for any other information, and that's also where you can request an application. If you have any questions at all, please feel free to email the email that's on the screen. And if you haven't already, to go ahead and follow our socials. And with that, we can conclude this portion of the informational session and open it up for Q&A, where we will have Samira, who is also one of the program coordinators at IFCO and former ELAM graduate, help with the Q&A. Thank you, everyone, for joining. Yeah, go ahead, Nicole.
I was just wondering in the email that we were sent, it said to send our questions in. So I wasn't sure if you guys had those questions that were also going to be answered, or if we should just reiterate those questions here in the chat.
Yes, we did get those questions. Um, Let me pull them up right now.
Thank you.
Um, so some the questions that were sent were about preparatory semesters for Spanish. So some of these resources are things that you can definitely find online in terms of language support. Um, and the same goes with familiarizing uh, with pre-med curriculum. There's a lot of resources that you can find online. Unfortunately, that's not something that IFCO can support with. Um, yeah. Samira, did you want to maybe answer the question about the under-resourced communities within Cuba?
Sure.
Thank you.
Hello, everyone. It's good to see you all. Thank you for joining us for this info session. So, Nicole, you had, I think, three questions, right? The first was concerning about Spanish learning, and as my comrade Ibtihal said, you will get that prep in Cuba, and by experience, the best way to learn Spanish is to exert yourself on the ground trying to practice with any and everybody because Cubans are very encouraging and they love it when you try, and that is how you will be able to assimilate the language easily. Because you can have all the apps and videos and resources, books in terms of language prep, which are helpful, but the real learning is going to come when you're actually putting yourself to the test every single day in communicating in different spheres, not just in the classroom, but in any extracurricular activities you involve yourself in, talking to any and everybody of every level of society, whether it's your professors, the cleaners, the residents, assistants, anybody, helps you build that vocabulary and helps you build that confidence. And Cuban Spanish is different. It is very unique and it's very fast. So it will require you some time to get used to. But again, especially at ELAM in those first few years, they emphasize people speaking slowly and trying to enunciate words because they know that we are all learners um, in those first few years. So you're not, nobody makes fun of you if you make a mistake. It's about your ability to um, do what you can and self-correct when you can. And if you're not able to self-correct, still be okay with the fact that you're learning the language. It's the best way to learn Spanish. And Cubans also have an excellent pedagogical method in terms of teaching language because you can imagine teaching young people from over 90 countries who don't all speak Spanish is a feat. And they have to do this in 6 months, right? So it is important for you to have confidence in the methods that they have in terms of language teaching, and then also do your part to practice. That is what is going to make you a fluent speaker. Um, so the second question is exposure to under resourced communities or Afro Cuban communities for the sake of gaining clinical exposure. I think that within Havana itself, especially given the fact that you would be on the outskirts of Havana starting off at ELAM in those first couple of years, you'll be exposed to some of the more rural like settings. And then as you move on and you become comfortable moving around, you'll also be able to get to the inner downtown areas and you'll be able to see where, in particular, there are neighborhoods that maybe have more, um, let's see, more populations that, or concentrations, I should say, of under resourced communities or Afro Cuban communities. Some of them are in Havana Vieja, some of them are in by the school in Santa Fe, where we have a lot of how do you call them, domestic migrants, basically from different provinces coming to Havana to live, and so they live in different neighborhoods. And because of that, because they're newcomers, they don't have as many infrastructure resources set up in the areas that they live in compared to places that are already established. So those are places that you'll have exposure to, as well as the places that the school takes us to on a weekly basis for our immersion in consultorios and polyclinics. You'll have freedom. I say all that to say that there's no limit to where you can go and where you can insert yourself, especially in the Cuban medical system. As long as you have your uniform on, you can go to any polyclinic and any consultorio. You tell them you just want to shadow or you want to help. They're happy to have you. And because your uniform and your ID is your ticket to learning in that system. So you will have many opportunities to observe and see. For example, in your case, if you are a student there, you'll be able to see where and find out where, for example, the cleaning ladies live. And if they live in a particular neighborhood, that may be an area that may be under resourced, and then they may have a real need for extra care, right? And so those are the sort of things you can pick up on, as opposed to maybe where professors live. They don't live separate places. They all often live in the same neighborhood, but you'll be able to see where there are higher concentrations of maybe university educated people versus technical educated people. But again, I say that very delicately because Cuba is a very, very mixed society. Literally, we have doctors and professors and different professionals living in the same neighborhoods as uh, cleaners or um, secretaries or anybody. So there's not a distinction of neighborhoods by what profession you have, right? But there are places, like I was mentioning earlier, that there are concentrations. For example, if migrants are coming from one province to another, they may organically gravitate towards one area, just because they're more familiar with their fellow provincial people. But it doesn't mean that there is a neighborhood of just a certain type of worker. So you'll have freedom to be able to explore any clinical setting and expose yourself to different parts of the population. And I think you had a third question. If I didn't cover it, was it was it the pre med content?
Yeah, I noticed on the website that it said that if you were struggling to learn anything, there would be additional resources while we're at school. So I was just wondering like what that looked like if you were really falling behind. I'll try to prep as much as I can, but
Yes.
it's just in case.
No, absolutely. And medicine is a lifelong learning journey. So if you are attracted to this path, you have to build up that habit of being able to dedicate your own personal time to learning little by little, consistently. And so I think it's an important question that you make, especially if you don't have a maybe a science background and you feel like you are coming in with a deficit. And even if you have a science background, um, believe me, medical school is a reality check for all of us. And so the resources, because we are now pivoting into a new system where we are trying to make it more accessible to people who don't have strong pre-med or pre-health backgrounds, we have to compile a list of resources. But in the meantime, I have a short list of a few resources that I'll put in the chat for you. And it will be helpful if I explain what they are a little bit so you have an idea, because essentially these tools are just the opening to what you will have to do for yourself and your fellow classmates, and those who may come after you if you get into the program. You will always have to be checking for resources that are available, that are free, accessible, for the sake of building your own library of information, um, and finding the best ways to learn things. So in the case of anybody who needs resources, I have put in the chat, for example, for pre-med in Spanish, I will go through the pre-med stuff first. There's Simply Med, which is an excellent website. It's UK based, but they have basically medical course content with the content and the quizzes and flashcards to help you learn and just get used to what it is that you need to learn. Khan Academy has a MCAT section just solely dedicated to MCAT prep. So even though you're not taking the MCAT, the content will still be helpful as a foundation. Coursera is a website that has lots of free courses. The trick is, although there are courses that you have to pay for, many of them you can just audit the class for free. So you don't have to pay for the class. So you just choose to audit it and not receive a certificate at the end of the course, right? So then you can sign up. So in the chat, you'll see there are a couple of medical terminology courses. I think that's the number one thing that anybody who's interested in pre-health should start getting under their belt is medical terminology. So if you have already taken any kind of course in that, excellent. But if you haven't, take these free resources and start building up your medical terminology base. And then Anki Web is a another excellent resource we use a lot in medical school, especially during the times of studying for the licensing exams. But it has a huge library of content. So, for example, you'll see in the chat, I have one list of resources for Spanish flashcards for learning Spanish. And sorry, to be more clear, Anki is a flashcard based learning system. It's spaced learning, spaced repetition, so over time. So you select any of the shared decks that already exist, or you can build your own flashcard decks. But the list that I shared are for Spanish and for MCAT content. So you can download any of those and download the app, and then you'll be able to practice over time any content that you wish to review. And then there's a GW Health Sciences library that has great content for not only clinical medicine but also public health resources, and they have a lot of open access textbooks and other content there on that website, which I think is great. And it's great because you have clinical medicine and public health, which is the life you're going to live in Cuba, is a merging of those two sectors. So it's important for you to start getting used to what is public health, what is what is public health in the context of clinical work. And then OpenStax is a resource by, I believe it's Rice University, and they have loads of downloadable PDF textbooks. So microbiology, any subject, essentially, you may find a PDF there on that website that you can download. So these are just the opening set of resources that will help you. But the key that I want to emphasize is that with this journey, each of us has to learn how we learn and how we must structure ourselves to be able to achieve our goals. So there is no time for procrastination. There is no time for cramming. You have to get used to setting some kind of calendar and a process for yourself. And I know it's not easy for everybody, but we live in the age of AI, where you can easily ask the engine to draft up a calendar or study schedule for you, or insert the number of hours you want to achieve each week, and it'll formulate a plan for you, right? That's an ethical and a beautiful way of using AI. So go ahead and use things like that to help reinforce your learning. No matter what level you are, we are in the business of continuing to learn because our communities depend on it. And so, yeah, that's a little bit of what I had to share in terms of that question. And I'm sorry, people are in the waiting room. Sorry, we're doing multiple things at once here. Okay. And okay, so does that cover your question, Nicole? So we can move on to.
Yeah, it does. Thank you.
No problem. Did anybody put questions in the chat? I'm looking.
Yeah, there's a question about, for those that apply by the 15th, when would matriculation be?
Those who what?
Apply by the 15th of February, when would matriculation be?
Oh, it would be in September. Sorry.
Yeah. And then for the students that completed residencies in the United States, how were their experiences? Were there any stark differences they noticed when practicing medicine in the US versus Cuba?
Oh boy. That is a loaded question, and it also probably requires a webinar all on its own. But I will preview you to that one in the future, inshallah. We may have that webinar. The Some of the experiences that U.S. ELAM graduates have had in residency, I think the stark differences that they've had to confront have been some of which have been stated by Ibtihal, is a fragmented system here, right, where there is a intentional separation between sectors in health, where the physicians have their own associations and their own ways of creating things. Nurses have their own ways. Public health practitioners have their own ways. Nutritionists have their own way. Everybody has their own association and their own uh, practice. And then everything is done to make you have to specialize in those subunits in order to function. You have to refer to a specialist or a professional within that sector, which is very different from the way we're taught in Cuba. To be a general physician in Cuba, you basically come out being trained as a jack of all trades, essentially. You have to learn a little bit of everything because the idea of physicians being trained in Cuba is for them to be able to go anywhere in the world and be useful. And most of the times when we see the global landscape in terms of healthcare and disease burden, Cuban doctors, and whether they're Cuban trained or Cubans themselves, are going to places where there is absolute zero infrastructure. And so they cannot rely on having a whole building of different subspecialties or um, interdisciplinary units already built into place because they don't have that that infrastructure built in based on whatever country they're in. They have to be able to manage, right? So for example, in the case of a general practitioner in Cuba, you are trained, and when you graduate you're able to do basic surgical skills, suturing, wound care. You have to be able to look at an assessment of a community health wise and take that data and analyze it to figure out what the main priorities are in terms of problems, health problems that need to be tackled. And these are all tools that Cuba gives us, but they don't really translate in the United States because in the United States, clinical medicine is literally focused on what you do within the clinical space, like within the hospital or the outpatient facility. It's not about you looking at a neighborhood and seeing, oh, because this neighborhood is right next to a waste facility, this is maybe why my patients have increased asthma cases, or they are showing up with rare cancer diagnoses. And what can I do, or what can we report to the municipal authority, because that's part of the base of the work that a Cuban doctor does based on the analysis that they do along with a family nurse, um, is to report their findings back to the larger authorities, whether it's at a provincial level, a municipal level, or whatever. And that will then drive the decision making about what needs to be done and the solutions that need to be made, along with the participation of the community. That doesn't happen here, right? We are in a situation where if you look at a lot of health assessments, um, they're county-wide. Counties in the United States are huge, um, um, huge, lots of land, but also very populous with big populations. And so unfortunately, the way that data is derived is not from the Cuban way of knocking door to door and actually examining everybody on the block. No, it's derived by essentially who's showing up to an emergency room or to a health appointment, which is not a reliable source of information because it's not everybody who's going to a healthcare facility, right? So you have these assessments that are made by health departments based on is serious guesstimation is what we're talking about. And so there's a difference when you come to this system and you now have to say, okay, well now I'm really I'm really dealing with health problems that are very complex because most US patients, residents find out, have lots of comorbidities. Like, and we know why that is, because if you don't make healthcare affordable, people wait and wait and wait until they have so many different health issues that unfortunately they become walking encyclopedias of different health issues, and they also have multiple treatments that they have to follow. And that is something that's very hard sometimes for US ELAM graduates to assimilate or get used to, because you don't have that huge population of people with 5, 6 comorbidities in a patient. It's just not that acute in Cuba, because the system has been built to try and prevent the manifestation of diseases to a large extent, so it doesn't cascade into having all of these other issues and then having to live the rest of your life with a terrible quality of health, right? A quality of life. So um sorry, it's a bit long-winded, but the question the question is complex, and it requires us understanding that training in the Cuban system, where you have a system that has all that it has, a robust structure that is supported by its government, is going to have drastically different results from here, where everybody is pretty much on their own, and a lot is being privatized more and more each day, and so the lack of accountability is growing, because there are no regulatory boards that actually enforce any of these private entities. So it's basically each man for himself. But in terms of our learning, some of the deficits that we do have um, are electronic medical records handling, because we live in Cuba. You have to handwrite everything. There is no digital system, and so things like that we have to get used to when we get into this system. And I'm sure there are other things that I could also mention, but just giving you those examples, which they sound like a few and they sound also like a lot, but um, that is the situation we're in, and I hope that answered somewhat the question.
It did. Hi, this is Phoenix. That was the question I asked. Yeah, I really liked that you went into detail. And that was one thing I was going back and forth on when considering medical schools, because I want to be a doctor that is useful and one that address prevent like health issues with preventive care as well. So I'm glad to that. Thank you.
Thank you, Phoenix, for your question. How did we get everybody? Questions?
There's a couple of questions about how quickly graduates can participate in the medical brigades. A couple of people asked that. And then a question on taking the USMLE exam as you go along while you're at ELAM, or do you have to wait until you graduate? Can you begin residency right after graduating, or is there a gap year based on ELAM's graduating timeline?
Yes.
Um,
These are important questions. Okay, so I'll go in order. In terms of possibility of participating in Cuban medical brigades, in the past, that has been based on the level of training that graduates have. So, from those first graduates, for example, that we had from the U.S. who participated in the Henry Reef Brigade mission to Haiti, they were um, they were graduates that ended up, some of them ended up doing a Medicina General Integral uh, specialty, which is the family medicine specialty in Cuba, which allowed them access to be able to participate in that brigade fully, and also earn them um, concurrently a specialty training, right? So that is that has been the precedent set. Basically, you need to at least be at either a resident level or completed in order to be able to participate in a medical brigade. And usually, because those medical brigades are primarily made up of Cuban nationals, if you want to solicit the opportunity to participate, you would have to send your request to the Ministry of Health to be considered and then fully vetted to be able to participate in one of those brigades. But yeah, that's the process. And then, oh, and caveat is that in the meantime, while you are a student, what we do encourage is that you should participate in student health brigades, which is something that you're more than equipped to do, especially after first year, because they teach you the basics of public health and the basics of physical exam and health and promotion, with the idea that you will go back to your communities in the summer when you go home and do student health brigade projects centered around some kind of health problem. So a few of our graduates in the past did that sort of work. And recently, one of the graduates, Dr. Abeku Ricks, led a group of African students from ELAM to go to Guinea-Bissau with that exact mission of doing a student health brigade. So they spent a month in Guinea-Bissau, going to rural communities and participating in health promotion and prevention exercises. So that's the build up. That's the building block to you being able to participate in a full on medical brigade, Cuban style. Then the next question is, yes, taking USMLE exams while you're in Cuba. Absolutely. That has always been the dream and the hope for US students when they're in the program. And from the very beginning, Cuban counterparts understood the importance of this and worked with IFCO and the Medical Advisory Committee in crafting the sort of curriculum that would be able to afford US students the ability to take their exams, whether it's after second or third year, and then later after fifth year for the second part. But the idea is for you to be able to do that, study for these USMLE exams and your Cuban studies. Does that always play out? Not necessarily, because our program doesn't have a hard, fast rule that you have to take an exam before you graduate, or you have to pass an exam before you move up in the clinical years, because the mission of the program is to train global health professionals, right? It's not to necessarily train U.S. professionals. So this is an add-on for U.S. ELAM that we have to study for these exams. And God willing, if you're able to combine, we always encourage people to do that. And the trend lately has been that more and more students in the program have been achieving that milestone while in the program, so that they're able to cut down the time between their graduation and inserting themselves into residency. Now, my case is not this, is that's not my case, because I went to Cuba and I was very set on studying the Cuban curriculum, and I didn't want to mix that with USMLE studying. I tried at some point after a lot of pressure from everybody, but then I also realized I did not want to sacrifice the quality of what I was learning in Cuba for the sake of studying and stressing myself out for the USMLEs. So I waited. Good or bad decision? I don't know, but that's for me. For me, it was a good decision, because I think I benefited a lot for the type of learner that I am. So it's important for you to know what your goals are and what you want to achieve. And for me, I think that it's also key for me to get a full picture of something before I start digging into the details, because the USMLE exams are very detail oriented, and they are set for you have to study a particular way in order to pass them, right? And so it's very different from the Cuban way of teaching and learning. And so we couldn't have two masters. That was my thing. So I chose my lane. But everybody has been encouraging our students to do what they can to study for the USMLE while they're in the program and do the exams. Especially now, because it's a different era. You have internet on your phones. When I started the program, you didn't have that. You didn't have Wi-Fi and certain things. So you have to weigh this situation at hand and see the resources that you have now that will facilitate your learning, which we're happy to say are more and more now. And thanks to the alumni who have continued to build a library and a resource of materials and advice and mentorship about how to tackle these USMLEs. It's made it easier for future generations to be able to achieve what they may have had a harder time achieving. So The other question, can you begin residency right after graduating? Yes, you can begin residency right after graduating, depending on if you finish your USMLEs and you're able to finish your ECFMG certification. Um, we are striving to have people's paperwork done by the time they graduate, so that shouldn't be an issue now. In the past, that was different; it was harder, but now that should not be an issue. You shouldn't. If you don't want to have a gap year, you don't have to have a gap year. Um, do students have to go home over breaks? No, they can stay in Cuba, and I do suggest staying in Cuba for at least a few summers, because running back and forth home is, is not the best routine. If you really want to immerse yourself in the culture and learn and grow with the people, you need to stay. And also, that's also the time that you get to know your friends and colleagues from other countries, because they're also staying in the country. A lot of them, they're not traveling, and it affords you the opportunity to travel in different parts of Cuba if you also want to do that. And those are some of the perks that unfortunately we miss out on if we keep coming home every summer. We're not able to go to different provinces, and the school is set up in a way that if you want to go to a different province, you can request a letter of authorization from the medical faculty of the province you're going to, so you can stay at the dorm for free. And that helps you cut down on certain costs. So there are certain things that we don't get to experience if we are running back and forth home. But we do also know that coming home is not necessarily a luxury for everybody. Some people have to come home for various reasons. So if you can, stay in Cuba for a few summers and see what that is like. Extracurricular activities available for students, lots of stuff. Sorry, this info session didn't have that content, but we can share with you older ones, or you can find them on our YouTube channel, where we talk about what daily life and the sort of extracurricular activities you can participate in. You can find that there. Um, Admissions rolling, not necessarily, because we've spaced it out, and we have set the deadline for February, primarily because there's a lot more paperwork that is required after February to be submitted, and because people need the time to be able to get those documents, it's important for us to stick to our timeline and then not overwhelm ourselves in the end if there are any stragglers or things that we have to follow up on. So it's not rolling admission. It's set by the deadline. If we do think that we need to make an extension, we will, but that's not a given. Do students ever spend time at other ELAM campuses? Okay, so yeah, the other ELAM in Venezuela is a sister school, but it is not necessarily ELAM. It their the name is the same pretty much, but it's not as it's not the sort of relationship where we have exchanges with the Venezuelan students, and they come to Cuba and we go over there. That's not the sort of system that has been set up. However, that sounds like a pleasant idea. Maybe in the future, Elam will consider a contingent of students being able to visit Venezuela and vice versa. That I think that would be great. Um, were there any students that practice medicine abroad? Yes, and you are Jamaican. Excellent example. Yes, there are there are a handful of U.S. ELAM graduates who chose to practice, whether in their home countries, like because their families are from a different country, or a random place that they chose to settle in. For example, there is a graduate who ended up doing family medicine and OB-GYN specialty in Cuba, and then went to go practice in Jamaica. So he's in the rural parts of Jamaica as an OB-GYN specialist, and he's happy. He doesn't have any intention to come back to the United States. There are a couple in Spain, more than a couple. Um, and there's one in the UK. Um, there are some in Latin American countries. So people, we are not limited. We are trained to be global. Global is our community. So you can go anywhere and do what you're called to do. Essentially, you shouldn't feel limited in any way. Okay, and I'm gonna try and finish these last few questions because we're over time. Um, does ELAM value experience volunteering in street medic organizations? Yeah, that's a valuable experience. Street medic organizations are uh, a, an essential part of the health infrastructure in this country. Unfortunately, it has to be that way because um, we have an a sad a sadly large unhoused population and people who need health care if they live in the streets, right? So if you're able to get that kind of exposure, that's excellent, and it's to your benefit and any community's benefit. All of those are excellent. Local rapid response, all of those are excellent because listen, medicine is not just clinical. And a lot of what we do and emphasize here at IFCO is about social justice because what we learn in Cuba is that health is a human right. And for us to be able to deliver on that human right, we have to be grounded in the fact that there are systemic problems that need to be resolved for us to um, truly make for a healthy environment, right? And a healthy life. And so, whatever angle in which you feel you are called to serve and participate in building a better world, you do that. But always understand that that also does not is that it doesn't cancel out the fact that you will still have to expose yourself to the nitty gritty of medicine that may be not nauseating for some. You have to you have to be able to thrive in an environment of bodily fluids, constant patient contact, and in Cuba, in a tropical island with all of these uh, crises, you have to have that grit that unfortunately most people only think that military medicine requires, but it actually is required of any humanitarian type of medical worker because you're thrown in environments that don't have enough and you're called to make do with what you have. So where that resilience comes from is from being in the streets and being in service to your community in whatever struggle they're going through, but also remembering that the other side of your brain needs to be working to solve the health problem that any of us can suffer, right? So yes, please feel free to participate and support in the current in whatever uh, struggle you think is important to you. Would U.S. medical certifications potentially allow students to participate in health related services before we have access to clinicals? U.S. medical certifications. Can you give me an example? Is this like maybe EMT or CNA? Is that what I'm understanding? Okay, awesome. Yeah, so and the question is in Cuba, right? You want to know if your certifications will help you be able to access the clinical setting um beforehand. Once you're on that island, it doesn't matter what certification you have. You're a medical student, they will allow you to go in there and have access to a clinical setting. This Cuba is not siloed in that way, right? It's not compartmentalized in that way that only EMTs or CNAs or PCTs can have access to clinical. That's not how it works. So this is why I emphasize that once you're a medical student, you can go to the lab and say that's what you wanna shadow the lab tech. Go ahead and do that. You want to shadow the phlebotomist at the blood bank, you do that. All of those things are within reach in the Cuban system, and you should and immerse yourself in everything and take advantage of it, because that it doesn't work like that in this system. So please, if you have any of those certifications, that is awesome, and you can just build on what you already have, and also help out in a huge way, wherever you do end up shadowing or volunteering in Cuba. um, So if you have, we will do our best to let you know as soon as possible, when you've progressed to phase two, because the earlier you submit an application, that's why we've been emphasizing to applicants, the phase one is due by February, but if you submit everything earlier, we try to fast track your process so you can have a review earlier enough to be able to then define whether you move on to phase two. So we don't want people to wait till February. We want people to actually submit earlier than that, so that they have time to build up the other documentation that they need in phase two. Okay, so I think I covered all the questions. Um, and now I'm parched. I wasn't supposed to be talking this much.
Thank you so much, Samira, for your very detailed and informative answers. I'm sure everyone on the call really appreciates
Yes,
the
and
answers
for
that you were
everybody
giving.
who showed up, I'm sorry if we weren't able to multitask, letting people in and all of that. It is recorded, so we will send you the recording. If you registered for this, especially, we thank you for making it. And those who weren't able to make it, we understand. Just please watch the recording and stay in touch with any questions you have. Ifti, Holly, and I will do our best to get back to you as soon as possible. And continue to spread the word. If you know that there's somebody who wants to be a doctor for the people, this is the program. We want you to go.
Thanks everyone for being on tonight, and hope to hear from you all soon through the applications.
And I hope you guys copy those resources in the chat. Those are preview to, the library that we're gonna drop on you. You guys are gonna have to learn a lot of things in this program. So copy those things, watch them. I'll be quizzing. Stay tuned. Bye. Good
Bye
night.
everyone. Good night, guys.